The Whistleblower examines nonpartisan issues of fraud, waste, and abuse at the expense of the American consumer, giving an insider's view into the risky, secret, and potentially lucrative world known as whistleblowing, and highlighting the courage and integrity of the Davids fighting Goliaths, and those who help bring about justice for others at their own expense. Host Mychal Wilson is one of America's most successful whistleblower attorneys, winning multi-million-dollar settlements against big corporations that have committed fraud and taken advantage of the consumer. He's also assisted various state and federal agencies in recovering over $580 million in American taxpayer dollars. The Whistleblower.
Welcome to The Whistleblower. I'm your show host, Mychal Wilson. Today we have another great guest, Mr. Matt Kochanski, who is a healthcare fraud expert. He's with Advize Health, and he's appearing live from Maryland. Matt, welcome to the show.
Hi, it's great to be here.
Okay, so you are our healthcare fraud expert here. You're with Advize Health. And, you know, I've done a lot of fraud cases, especially, I was once a pharmaceutical rep, so I've done a lot of healthcare fraud cases, medical device and drug companies and drug pricing. And now it seems like there's a shift now in terms of rooting out fraud. Initially, you had providers who were committing fraud, whether it was kickbacks or stark violations, and now you have non-providers. Can you kind of go, for the audience out there, what's the difference between a provider and non-provider, and what type of fraud non-providers are committing now?
Sure, absolutely. Well, a provider is, a physician, laboratory, durable medical equipment company, hospital, hospice, home health agency that provides services to those that are carrying insurance and then bill for those services. And, the traditional fraud is that they would bill for something that they don't do, or that they were paid to refer a patient to another provider for a specialty service, or received kickbacks from a provider, those types of things. Non-providers that are involved in healthcare, there's a continuum of them. They could be the billing companies that work for those providers, the management companies that sort of manage their practices. They're not providers themselves, but they can somehow dictate what the providers do with their billing and exaggerated upscale things, especially if they're paid on a contingency basis. Then there's also marketing firms that work with entities such as durable medical equipment companies and laboratories to promote themselves to the general population through television ads or through telemarketing. And there's a lot of schemes that are involved in that as well, in terms of getting people services that they don't need, medical equipment that they don't need through this telemarketing scheme. And then there's also device manufacturers, and that's something I wanted to spend a little bit more time on. And these are the folks that they develop and create medical devices, whether that be for diagnostic testing or for treatments. And many times what we'll see with those device manufacturers is, they're ahead of the game. They are creating devices that there's no regulatory guideposts for them yet. That, the insurance companies have never heard of them or have not had a chance yet to see whether or not they should cover them. They haven't decided on, how much should they pay for them if they are covered, and what types of conditions should they be paid for if it's specific to a particular type of diagnosis or treatment. And the device manufacturers, what I've seen recently is they're taking advantage of that gap. Mm-hmm. And they're marketing their device manufacturer, their devices to the provider community, to the local doctors, to the laboratories, to the the diagnostic clinics. Well, along with marketing them, here's a new device, and here is how you can maximize the reimbursement for using it, including telling them how they can bill it, what codes to use to bill Medicare, Medicaid, private insurers to get the most reimbursement for them. And the problem is, it's not covered for those things yet. Those decisions have not been made. But usually what these codes are, they're disguising what's actually being done with something that's already been, something that is covered.
Right.
So these providers are making money. The device manufacturers are making money from their sales. And it's all for things that aren't covered yet are probably medically unnecessary and could be medically dangerous
Right.
to the community.
So, Matt, when I was with Bristol Myers Squibb, what we would do is we would go to doctors' offices who were providers and say, hey, if you give us more prescriptions of, say, Provocol. I was a cardiovascular and diabetes rep for Bristol Myers Squibb. So I would say, hey, if you give us more prescriptions, we can actually upgrade your whole system here. We can give you a computer system, and you can track your patient's cholesterol and diabetes and blood sugar levels all through the system. But, just give us the more scripts, and we'll put in the system. And doctors loved it. They said, okay, fine, because it means that they were transitioning from paper to a digital system, which made it more efficient. Is that what you're seeing with device companies, kind of in a way, with providers now? Or is it more of going in there? Is it more intrusive, where you're going in there and you say, hey, you're missing out here on maximizing your patients because you should be billing for this, and that?
It's a little bit of both. It's, hey, we've got this new machine, and I'll give you an example. We have, for a while, this is an older one, Claravane. It ablates the veins in the legs, gets rid of varicose veins. Not covered for that. But hey, here's a new type 1. It's more efficient. It's effective. It costs this much. You pay me, the manufacturer or the distributor, this much. And here are the codes you can use to make this much money per patient from using this device, even though it's completely not covered by most insurance companies. But use these codes and it's covered.
Right.
It's that blatant.
Wow. And so, I can see to maximize sales, and I can see the companies doing it. What is it? Where's the integrity for the providers, though, such as the doctor's office? Is it because they're under so much pressure to create more profit, and it's so hard nowadays that, they're saying, okay, any little extra here helps?
Yeah, it's simply, it bolsters their profit margin. Absolutely.
Right. And so if someone works for one of these non-providers, or someone wants to blow the whistle and report this fraud, what are some of the key elements that you find out that the whistleblowers need?
What the whistleblowers, some of the great evidence are the marketing materials that the distributors give out, and it'll have and we've seen examples of that, when I was with the IG and with the UPIC. They are, pamphlets that show by patient, here is your profit margin. If you bill it this many times, you have the patient come back X number of times, use these codes. These are the fee schedule for each of these. And this is how much money you can make versus here's how much the machine will cost you. And here's where your break-even point is and how much money you can make after that. So that marketing material, and we've used that with the Department of Justice on some other schemes, and that was the prime evidence that they used was those marketing materials. Also, if you're a billing clerk, your provider comes to you and says, for these claims, use this marketing material as your guidepost for billing instead of using the CPT and using the LCDs or the NCDs from Medicare. Use these marketing materials. So that type of information, that type of direction from the provider is prima facie evidence that there's something wrong going on. Another would be, is there something completely outside of your scope of specialty going on in the office now that, how did this come about? We had a large scale project from ophthalmologists billing for transcranial Doppler tests. These are tests usually done in the hospital for stroke victims. Right. All of a sudden, ophthalmologists all over the country were billing for these tests in their office as part of the annual screening tests for their vision tests for their patients, and making hundreds of thousands of dollars.
And how did that come about? I mean, how did that get pitched to ophthalmologists?
It was from the device manufacturer. For some reason, they chose ophthalmology to go and hit those people up, and they just went door to door. And then it was, by, just hand to mouth. It was one or the other. This is how much money they were making. And it went from one area of the country to the other. And it became a nationwide fraud. Wow. And it's still growing. It's still out there.
And so do the ophthalmologists, do they pull away and say, hey, this doesn't seem right? Or is it there's so much profit driven, there's so much greed out there that they said, okay, you know what? Well, the DOJ may investigate and the company will take the fine and not us. Because a lot of times, unless it's something egregious like Dr. Fatah, who was giving chemotherapy to patients who didn't need it, the government doesn't go after the provider. They usually, in that sense, they would go after the companies. I mean, what's
right, and that's what they were using the providers as witnesses, as cooperating witnesses against the device manufacturers, and it'd be up to the insurance companies, like with the UPICs, and to take take administrative action against the providers, go get those overpayments, and for us in our investigations, get that evidence that DOJ needed to make those people cooperating witnesses.
Right, and also, now you're talking about with cooperating witnesses. I mean, a lot of times you find physicians, there's a brotherhood, there's a code there, and physicians don't want to report against the companies because they're also getting, money from the companies. Where are the doctors out there who do report? Are they disgruntled doctors that maybe got cut off a speaker program and aren't receiving funds anymore from the company? How does that work?
It's those that feel they were duped by the manufacturers, because they were being sold a bill of goods that this is the right way to do it.
Right.
And even though sometimes you might be somewhat of a willing dupe, but they still felt duped, and they were on the hook then for the overpayments, and they had to work with the insurance companies to pay all that money back. So they felt like they had been taken advantage of, and then were willing to cooperate.
Wow. Okay. Listen, hey, Matt, we have to take a break, but when we come back, let's talk about new areas of healthcare fraud out there. There's been a lot since the pandemic. I know the DOJ was concentrating on there's been telehealth schemes, all the Zoom appointments that didn't really occur. But if you could give the audience a little forecast out there.
Sure, absolutely. Love to.
We'll be right back with the Whistleblower. All right, welcome back to the Whistleblower. The great guest here, Matt Kochanski, who's appearing live from Maryland. So, Matt, what are some new areas of healthcare fraud? I mean, you've had traditional against big pharma, you've had unnecessary billing, you've had hospitals, the random doctor who is giving unnecessary chemo treatments. But since the pandemic, there's a lot of money out there. There's a lot of autonomy out there. There's a lack of government oversight. What are the new areas here?
Sure. During COVID and still you see a lot of the COVID tests, COVID vaccine frauds, where even on social media, you can see some, gray market ads for, hey, buy your COVID tests here, or get your free COVID test, get your vaccines here on the gray market. All of that illegal. There's also, for COVID tests, you had a lot of drive-through clinics, right, that were giving the vaccines. Well, what we saw, and we continue to see, they're also billing for other services that were never rendered, whether that be office visits, other tests, other vaccines that were not given. All of those are being billed on top of the COVID vaccine or the COVID test that was being given in that drive-through. There's also genetic testing is a big area of fraud right now, where genetic tests to see whether or not you have a propensity for cancer.
Oh, wow.
Under Medicare guidelines, you have to have cancer in your history to be covered for those tests.
Uh-huh.
Well, going back to those marketing firms, they were calling people, does anybody in your family ever have cancer? Yeah. Yes. Okay, you're good. You're eligible for that test. Let me get your beneficiary information. They would send the beneficiary information, get the test, maybe not get the test in the mail, but Medicare was getting billed for that test and many, many other ones. So there's that. There's always that telemarketing scheme. Telehealth is another area now. I mean, telehealth is a great vehicle for medical services now that allows you more access to your provider, but it's also ripe for vulnerabilities in terms of, we've seen lots of billing for telehealth visits that really don't reach the criteria for a true telehealth visit. It might be, a follow-up on a medication management type of thing, but they're billing the full telehealth visit, and there's no real way to find that in the data. So it's very difficult detect.
Right.
So insiders would be wonderful if they find that, as a billing clerk, there's all of a sudden this huge spike in telehealth visits for patients where in the notes and in the super bill, it's basically just a medication management type of thing. That's evidence that would really support a qui-tam.
Okay. And for advice out there for, say, the actual providers like doctors, I mean, how do they, so they don't become an accidental victim of a fraudster, of a fraudster company? I mean, what advice would you give them if they get a call from a marketing company and they said, hey, listen, you maybe have some issues, but we can really maximize things for you here, where you can actually, get more revenue coming into your practice. I mean, for a doctor may say, oh, this sounds great. It's a new way, revenue generating stream. What advice would you give to them? Like, how do you vet these companies out so that that as a doctor or provider, you don't get stuck being, a witness in a federal investigation or getting squeezed by the feds?
Yeah, I mean, you can do your own type of Google searches on the companies themselves, on the people that are approaching you, but the bottom line is, if they are telling you, there's only one entity that should be telling you how to bill, and that's the insurance companies. It's Medicare, it's Medicaid, it's the Blues. They're the ones that are setting the rules. They're the ones that are setting up the coverage regulations and policies. Having a marketing firm or a device manufacturer coming to you saying, this is how to bill, that should be, red lights should be just spouting off as soon as you hear that, because it's just too good to be true.
Right. And so these companies, like these marketing companies, I found, they've actually started creating referral dinner programs and stuff like that, especially in the pharma world, basically recruiting doctors, become who can refer business to other doctors. Have you been seeing a lot of that out there as well?
Yes, we see a lot, especially in the durable medical equipment field, where, in the data, what we see is, lots of equipment being ordered by a physician that's never treated that patient. Okay. And how that comes to be is that the marketing firms are hiring these physicians for, a consulting fee, whether that be $25 an order, $50 an order, whatever it may be. And then, they're not talking to the patients. They're not examining the patients before they order the equipment. They just get the order in front of it. They sign it, and they get their check. And, for investigators, what we see is that data that shows this patient got a lot of equipment that they had no history to seemingly that they needed, and no history with that provider, with that doctor that ordered the equipment. So how could they possibly know that was needed or not?
Right. And so DME, or durable medical equipment, for those out there, can you explain what are some common types or more types that are susceptible to fraud if people are noticing, these type of schemes?
Sure. And durable medical equipment runs the gamut from wheelchairs, scooters, hospital beds, all the way to wound care kits, diabetic test kits. What's been the latest large-scale scheme that we saw was in the braces, the elbow braces, knee braces, orthotic braces, that it seemed like beneficiaries were getting them hand over foot from multiple companies on the same day, where a beneficiary was getting every brace for every joint on their body from 2 or 3 different companies on the same day, because they might have called that number at 3:00 in the morning,
right,
and said, "Oh yeah, my back hurts." All of a sudden, they're getting bombarded with things ordered by a doctor that's never talked to them or seen them. And we've gone into houses of these beneficiaries. There's boxes stacked on the wall of this DME equipment. They've never opened it.
Wow.
And they're just begging for the phone calls to stop, because they get 10 of them a day now, because they're out there, they're compromised.
Right. And so what happens down the road with the beneficiaries? In these investigations, do they get called in as a witness too, or are they, what happens to them?
Yes, we usually, as investigators, with the UPIC, we would get sworn statements from them. We would take pictures of the equipment. We would put together a referral package and send that to, law enforcement, the OIG. And then those beneficiaries, would probably be called as witnesses in grand jury or trial by the OIG and in the U.S. Attorney's offices.
And so from the government side of things, say for the DOJ or OIG, what are some of the hot things they like to investigate out there? In terms of the schemes, for people who want to blow the whistle. Because I get a lot of calls saying, "Hey, there's this healthcare scheme. They're doing this, and this company is doing that." But there's really one thing people don't realize, that you need the specificity. It's fraud, so you need the who, what, why, when, where. What is it that you see that the government really bites on here?
They bite on services not rendered. So the simple, they didn't do it and they billed for it and they knew it was wrong. And when that can be possibly put together with harm to the patient. Like you talked about the chemotherapy guy that wasn't giving chemotherapy.
Yeah.
That's harm to the patient. One of my first cases as an OIG agent was a doctor who, because of gambling debts, couldn't afford, and he was an oncologist, couldn't afford the drugs for his office. So he was using water. He was injecting water into his cancer patients rather than chemotherapy drugs because he couldn't afford to buy them.
Wow. And what happened to him?
So we had false claims and actually he killed himself before he went to trial.
Oh, really? Oof.
Yes.
Yeah. Listen, Matt, we have to take one last break. When we come back, I want to hear one more crazy thing that you've seen out there in all your years. I've seen some crazy stuff. I've worked on some crazy cases. And then also how people can reach out to you.
Sure. Great.
We'll be right back with The Whistleblower. All right, welcome back to The Whistleblower with our great guest here, Matt Kochanski from Advize Health. Okay, Matt, so one time I got a call. I'll make this real quick. One time I got a call from a friend who said she had been sexually molested. The doctor had a scheme where the doctor came in, gave an exam, pre-birth, after birth, went outside with the chaperone, the nurse, came back in by himself, and orally assaulted the patient, sexually assaulted. And had a scheme where now, like he did it, Dr. Robert Haddon, Columbia Presbyterian, back in New York, there's like almost 1,000 women have come out. So he had this scheme. What's the craziest scheme that you've seen out there?
There's a couple of them. I'll give one with a doctor that was a fertility doctor in Northern Virginia. Came to light when a bunch of the women that had babies based on the work that he had done, all the babies had lazy eye. All of them, like 20 of them. Turned out the doctor was using his own sperm to fertilize the eggs.
Oh, wow. That is crazy.
So that's one.
That's one. That is crazy.
Another was a doctor that believed that MD stood for minor deity. And this was in a licensing issue that we were dealing with. He was actually injecting his own urine into the patients because he believed it was a curative agent.
Oh, wow. Okay. I mean, I've heard people drinking their own urine, but not injecting. That's crazy. And so was it, in this case right here, was there patient harm? What happened to those patients?
Well, there was patient harm. They were getting sick from that. They weren't getting any better from what they had. And that this was, we brought this forward to the licensing board. And part of the hearing was when he mentioned that MD is minor deity. And he was proud of the fact that he was injecting people with his own urine.
Wow, that's crazy. Okay. You got another one, or is that a wrap right there?
I think that's good. I think that's a wrap.
Okay. Listen, so how can people reach out to you and Advize Health, and how can you assist, whether it's, I would say the consumer or attorneys out there?
Sure. Advize Health is it's a small company. I'm a senior manager there. You can reach out to me at mkochanski@advizehealth.com. We do SIU work for insurance companies. We also work with plaintiffs or relators, attorneys. If you need investigators, we can do that. We can help you put together a qui-tam if you like, or work with you before you go to an attorney if you're a potential relator. We can help you put together a good package that a relator's attorney will be happy to get and put together the qui-tam for you. So we can do it from soup to nuts at Advize. We've got lots of good people, lots of former OIG people like myself, lots of people that come from the MCO world, from the commercial world, and we've got nurses, we've got investigators, we've got data analysts, so we've got the entire embodiment of what a good SIU/program integrity office needs.
Well, sounds great. Listen, we got to sign off here. I want to say thank you so much for being your high sense of morality and integrity for what you do. Obviously, your service in the government, and for being out there, being courageous, and trying to fight against the fraudsters out there. I'd love to have you back on the show in the future, Matt.
I'd absolutely love to have it. Love to do it again. Thank you so much.
Thank you. Have a good one. And thank you for watching another episode of The Whistleblower. If you or someone you know is aware of fraud, abuse, waste, or corruption, then please visit our website, thewhistleblowershow.com, to learn how to legally blow the whistle. I'm your show host, Mychal Wilson. Stay tuned for the next episode of The Whistleblower.